Hello and welcome to Aging Matters, a program featuring individuals who talk about aging-related issues of interest to older adults and their families. I'm Cheryl Beversdorf, your host. Each year, approximately 9,500 deaths among older Americans over 65 are associated with falls, the leading cause of death from injury for this group. Falls can threaten older adults' safety and independence and generate economic and personal costs. Today, my guests are Sara Pappa, coordinator of the Northern Virginia Falls Prevention Alliance, and Julie Ries, professor in the Department of Physical Therapy of Marymount University. They're going to discuss causes and risk factors associated with fall-related injuries among older adults and also describe practices and programs available to prevent injury and death. Later in the show, physical therapist Letha Zook and Carol Burnett of Arlington will explain and perform a falls risk screening to determine Carol's risk for a fall. So thank you, Sara and Julie, for joining me today.
Thank you for having us.
Okay, well, let's start out with some basic information. And Sara, we're going to start with you first. How common are falls among older adults? I mentioned some numbers here, but tell us a little bit more about it and what is the impact of falls?
About 1 in 4 older Americans falls every year. You mentioned a number associated with deaths from falls. We know that about over 800,000 older Americans are hospitalized because of falls every year, and that's a huge concern, not only for the serious injury posed to those Americans, but also the cost, the economic cost, which we know is actually over $50 billion annually to care for the medical cost related to falls. And it's not only the medical cost, but you mentioned sort of lifestyle issues. And we know that when seniors fall or if they have a fear of falling, a lot of times they limit their activity and they limit their social engagements, and that just sort of can snowball the problem, and it can cause even further physical decline and also feelings of depression and isolation if they're not feeling like they can go out and do the things that they like to do.
Is falling an unavoidable result of aging? I mean, you just hear about this all the time, and it just seems like, gee, if we're getting old, is this likely to happen?
Right.
Tell us.
The good news is it's not inevitable. Yes, as we age, our risk for falling does increase. Our mobility declines, our ability to adjust to a changing landscape changes, our physical fitness can decline, but with some work and with some hints around the home, we can prevent most falls, and that is the good news.
And that's why we're having this program today.
Right.
So Julie, what are the most common injuries that occur among older adults as a result of a fall?
The good news is that most falls don't result in serious injury. So bumps and bruises and scrapes are the result of most falls. And we kind of alluded to the fact that there can be really negative impact from falls, even if you aren't injured seriously. But most falls are not associated with serious injury. When someone does have a serious injury, it generally will fall into 2 categories. Fractures is one, and then head injury or brain injury is the other. So other things can happen, but these are the most common. Hip fractures, the primary cause of hip fractures in older adults is falls. And so hip fractures are quite common as a result of a fall to the side or to the bottom. And then arm fractures, people will put their arms out to protect themselves from a fall, but if they have osteoporosis or bones that can't withstand the impact of hitting the floor or a supporting surface, they end up with a fracture. And then head injury can occur, or brain injury, when the head hits something on the way down or hits the floor when they land on the floor. Or brain injury can also happen without direct impact to the brain. So even if somebody falls very firmly onto their bottom, if there's enough of a jarring force, then the brain can withstand a little bit of motion within the skull, and that can result in a brain injury. And the spectrum can be quite mild, a concussion that will hopefully resolve, to very severe brain injury that really changes somebody's ability to care for themselves.
Well, and that's very helpful, and it just seems like falls relate to many of the other conditions of getting older.
It's true.
And to that point, Talk to us a little bit more, Julie, about the mental and social issues as a result of a fall. I would imagine that probably both short-term and long-term. What would you tell us?
Yeah, so even if a fall does not result in serious injury, it can have huge implications for somebody's confidence. It can cause them to be anxious about returning to the scene of the fall. So in other words, if someone falls in the community, they may be very hesitant to venture back out into the community, and their world will shrink. And if you don't venture out into the community, over a period of time, your ability to be successful in venturing out into the community will be impacted. So that's probably the biggest emotional and psychological problem with falls, is that it decreases somebody's mobility. They choose not to go out, not to do the activities that they would otherwise do. If you experience a fall, it increases your risk for future falls, and people know that. And so they are nervous and anxious about what might happen the next time they put themselves in that situation.
They probably can get depressed, too.
Absolutely,
Yeah.
absolutely. When your world is shrinking, that can be really overwhelming.
Right. So, Sarah, let's talk a little bit about where do falls happen. I mean, people spend a lot of time in their homes. Are there certain places in the home, certain rooms where falls usually occur? And if so, are there especially areas of those rooms where it happens? Explain to us what they need to know.
So most falls happen in the home, and most of those happen in the bathroom. They tend to happen if the floor is wet. So in the bathroom, you can imagine the floor might be wet, which would make it slippery. Getting up and down from using the toilet can cause a fall. Getting in and out of a bathtub or shower can cause a fall. So we talk to people about making sure they have some grab bars. Also in the kitchen, perhaps there's a throw rug in the kitchen, maybe by the sink, or maybe somebody has spilled something and there's a slippery spot on the kitchen floor. We also talk in the home about thresholds between going from one room to another room. Is there a threshold? And trying to eliminate that, or maybe making it a different color, so that people are reminded that there's a difference in depth there. The other place is the stairs. We talk to people about having railings on both sides of the stairs, keeping the stairs clutter-free, and making sure that they also have a non-skid surface on them.
And how about outside? Obviously, when they go outside, there are probably
lots of hazards. Lots of hazards outside. So we talk about sidewalks and that are in disrepair, that might have cracks or raised areas. We talk about, again, anything that's wet is going to be slippery. So in the fall, when leaves get wet, they are very slippery. Obviously, snow and ice are also slippery. Just using crosswalks can be challenging. If you're starting to cross that crosswalk late and you know that your time is ticking down and you have to speed up, and then up and down on curbs can also be an issue.
And I suppose, too, if they have stairs, like if they're living in a single-dwelling home on the porch, would you?
Yeah, porch stairs. Right, just we talk to people about keeping them in good repair and making sure that they're not cracked or broken, and that those hand railings are also in good repair.
Okay. So, Julie, let's get back to you. You mentioned a little bit about common injuries. Let's talk a little bit about vision and hearing. Some of the, again, situations that occur as we get older, and also balance. I would suspect that that's a big thing. So help us on that as to what we need to know.
Impairment in balance is one of the risk factors for falling. And when we think about what informs our balance, what gives us the information we need to balance well, vision is very important because it helps us determine vertical. We use our eyesight to just look in the corner of the room and know what is true vertical. And so we know we need to be in line with that. Hearing is not as important as really the inner ear itself. So our inner ear holds what is our vestibular system, which is really kind of a carpenter's level that tells us where we are in reference to gravity. So again, it gives us an idea of what is truly upright. And then we also gather information from our feet and our legs, sensory information about the surface that we're on. So those three things, vision, the inner ear, the vestibular system, and then the sensory information from the surface we're on and from our joints in our legs, those all inform our balance system. And our brain takes information and figures out, what do I need to do to be upright and stay upright, given that information. So you can imagine if you have difficulty with vision, or you try to walk in a poorly lit area, you can't utilize that to the best of its ability to inform your balance. And with aging, there are changes that happen to our sensation in our legs and to our vestibular system. So it gets a little harder as we age to utilize all that information well for balance.
And so it's those factors plus what you were talking about, Sarah, as to hazards in the home. It can be quite dangerous. And then taking one step further, because oftentimes older adults are on a lot of medications. So talk a little bit about that, especially if there's multiple medications.
Right. So a lot of older adults have multiple medications. We call that polypharmacy. More than 4 medications in a given day is often the descriptor of polypharmacy. And it's a little bit of a confounded variable, because somebody who's taking many, many medications probably has many, many underlying medical issues that they're trying to deal with.
Sure.
But people who are on polypharmacy do tend to fall more than people who are not. And there are also certain medications associated with falls. So the medications, two main groups. One kind of what we call the psychoactive drugs, so the ones that impact the brain functioning. So antidepressants, anti-anxiety drugs, sedatives, those are probably the most common medications that generally people are taking that might impact their ability to maintain upright and balance, and drugs that impact their blood flow. So people who are on hypertensive medications, those medications might inadvertently lower their blood pressure too much and make it hard for them to maintain good blood flow when they stand or when they're upright. They may feel dizzy.
And I suspect, too, the other thing that is so troublesome insofar as polypharmacy and multiple medications are the side effects of drugs that can occur, that people end up taking more medications to treat the side effects. And that makes it even worse. Would you agree?
Yes, and the best thing that one can do is to interact with a pharmacist or your physician to really look at the drugs that you're taking and be sure that you have minimized them, the dosage, as well as the number of different drugs that you're taking.
All right. Well, a falls risk screening is a tool that healthcare providers use to identify older adults at a higher risk for a fall. So we're now going to see physical therapist Letha Zook and Carol Burnett of Arlington. They're going to explain and perform a falls risk screening to determine Carol's risk for a fall. So let's watch.
All right, now that you've heard how important the prevention of falls is, we're going to do a screening of exactly what we look for when we're doing different types of assessments for risk for falls. So Carol's going to help, and we're going to do some things together. But what we're going to do, we're going to do 4 different tests. The first test is a very general test. It's looking at how you move from one place to another. The second test is going to look at your balance and how you can hold yourself still in space. And then the third test will be looking at strength of your lower extremities, and then the last one will be looking at strength of your upper extremities. All of those things give us information about your risk possibilities for falls. It also helps us make sure that we know exactly what to do with an individual. We're very clear about making sure that the prescription that we give for exercise is very individual for the patient. So, Carol, what I'm going to ask you to do is I'm going to ask you to walk up, go around that cone, and come back and sit down. And what I'm going to do is I'm going to time you. Now, but I want you to go at your normal pace. Don't try to run or anything. Just try to keep at your normal pace, and I'm just going to keep time for you, okay? So when I say go, just stand up and walk across the room, okay? Ready? Go. She's fast. Woo! Okay, good. So what we'll do is we take that time, and we have age and gender norms that we put that against, and you did extremely well on that one. Okay. The next one, we're going to be more specific about balance, and so we're going to have her stand beside the chair. Now, Carol, I'm going to give you 4 different positions, and in those 4 different positions it's going to gradually get harder for you to do this. But I want you to just take your time, and I want you to stand for 10 seconds in each position. Okay? First position is to put your feet as close as you can together. Do you have your balance?
Yes.
All right, let go and go ahead and stand. Can you stand there for 10 seconds? What we're looking for is how she stands and is able to hold her balance. Okay? Okay, good. She did that one very well. All right, now the next one I want you to put your halfway up with your heel right at the instep of your foot. Okay, you got your balance? Okay, let go of the chair. There you go. Stand up there nice and tall. Good. And we're looking to see if she has any problem with her balance. Good, you did that one for 10 seconds too. Now we're getting a little bit harder. I want you to put one foot in front of the other. You can hold on to me in order to, there you go. You got your balance?
Yes.
10 seconds. See if you can hold it there. Okay, this, you can see this is a little more difficult. She's moving her feet a little bit, trying to keep her balance in that way. But she got 10 seconds on that one too. Good job. All right, now the next one, I'm going to have you hold on to the chair here. I want you to take one foot and stand on one foot. See if you can do that for 10 seconds. Okay, go. Okay, this gives us an idea of what happens when she's walking, whether she can hold her balance and make sure that she doesn't fall. Okay, good. All right, so she did all 4 of those tests for at least 10 seconds, which gives her a very good score on that. So congratulations on that.
Thank you.
All right, now we're going to move on to the test that looks at the lower extremity strength. And what I'm going to have you do is I'm going to put on my clock for 30 seconds. I want you to cross your hands across your chest. And for 30 seconds, I want to see how many times you can stand the whole way up and sit back down again, okay? So I'm going to tell you when to go. Hold on a second. Okay, ready? And go. Up the whole way. 1, 2, 3, 4, 5, 6, 7. And you can see that she's using her legs to do that. 8, 9, 10, 11, 12, 13, 10 more seconds, 14, 15, 16, 17, good. All right, and so we have norms of what age range and for gender as well on that. Okay, do you need to catch your breath or are you good?
Good.
Good, all right. Okay, the next one, and you wouldn't think of this much as a balance or preventing falls, but this exercise is going to test your upper extremity strength, and it just is a good way for us to tell your general strength and be able to determine that. So what I want you to do before I hand you the heavy weight, I want you to make sure you can bring your arm up and down. Okay, all right. So and we're going to do that again for 30 seconds, all right? So you take that and we'll hold it that way. All right, go ahead and start. Up, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, halfway, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22. Whew, that was good. Now you have to do it on the other hand. No, we only do that on the dominant. We do that with the dominant hand. All right, so each one of those tests, you were at above normal for your particular age group. Okay, so we can congratulate you on that. So when we look at this, if she had trouble holding her balance or being able to stand, we would put her at a higher risk for falls. If she was unable to stand on a single leg or having what we call tandem stance, that's also very difficult, and we would have her go for some physical therapy evaluation and make sure that we could have a program that would be specifically suited for you. But because you're so good at all of these exercises, what we would recommend for you, Carol, is that you would find a community activity or something to do just to make sure you keep yourself active. Tai Chi, some type of exercise balance program. Also walking, you try to walk at least 30 minutes around. I understand you have a dog. That's always helpful to have a dog to walk. It gives you something to do. And that way that you can just keep yourself as active and going as quickly as you can, okay? But you're doing a great job. Thank you very much for volunteering with us today.
The demonstration Letha and Carol provided shows one way to determine if older adults may be more susceptible to falls. The screening also gives valuable information to their healthcare providers. So since this is so important, Julie, we want more information. Where can older adults get a falls risk screening? Does insurance cover this test? I'm sure our viewers will be interested to know.
Well, it's a great idea to kind of keep your eyes and ears peeled for screenings that are happening in the community. So senior centers, community centers, public health fairs oftentimes will provide the opportunity and free for a falls screening assessment. So that's a great place to keep your eyes peeled at local announcements for those types of things. Physical therapists are really a perfect option for having a falls screening. And physical therapy is available all across the community in private settings. Physical therapists are trained to carry out these falls screenings, but also to do a comprehensive evaluation and determine exactly what is the best way to manage somebody's specific fall risks. Medicare will support a physical therapy visit for a falls screening and follow-up treatment based on what the physical therapist determines is appropriate for somebody who's identified to be at risk for falls. It just entails the physical therapist providing documentation and a plan of care to the primary physician who will sign off on this.
He'll give the order, or she'll give the order.
But it doesn't need to happen up front. It can happen after that screening occurs.
Okay. So advise, now we've talked about all of the risks inside the home, outside the home, and what can happen. Tell us about the measures that older adults can take to reduce their risk of falling. That's really what we're all about here. Sure.
So talking about a lot of the things inside the home that can put somebody at risk, there are a variety of different falls checklists for home safety that individuals can access to kind of take care of their environmental risks for falling. But in terms of your own health and fitness, there are a lot of things that an older adult can do to minimize their chances for falling. So again, a physical therapist who evaluates somebody will prescribe appropriate strength and balance and flexibility exercises. But everyone doesn't have to go to a physical therapist in order to participate in those things. So strengthening activities, balance activities, and flexibility activities can be done in the context of community programs. There are things like Tai Chi that offer all of these kind of combined into one in different community settings. But even at home on your own, I mean, I often will encourage people to raise up on your toes or stand on one leg when you're brushing your teeth. You have to stand there at the sink anyway. So let's make good use of this time.
May as well lift your leg,
and
right?
You can be safe in that environment and practice these things.
Sure. Okay, so of course things may happen and falls may happen. So I want to just ask you, in the event that an older adult does fall, what are the actions that they should take?
Right.
I mean, you say they don't usually get an injury, so we want to make sure that that's exactly the case. We want to minimize the injury. What would you advise?
Right. So in response to that, in most falls, really what you want the person to do is stay calm, which is hard because it's very disconcerting to find yourself on the floor. But stay calm, do an inventory. Just try to determine, am I hurt or am I just stunned from this fall? Certainly call out for help if there's help available. And if you're on your own and you're prepared to get back up, get yourself to a sturdy piece of furniture and use that to stabilize yourself as you're getting back up. One of the things we love to see older adults practice before they fall is an ability to get onto and off of the floor in a really controlled fashion. So it's a good skill for somebody to have ahead of time.
Sure.
We also encourage anyone who's had a fall to keep their phone on their person at all times.
Good idea.
Because if you do find yourself on the floor and you are seriously injured, you want to be able to call for help.
Right, right. Well, then what we need to do is learn a little bit more about some of these programs that are available. And we're going to learn about that Northern Virginia Falls Prevention Alliance that you are a part of. So Sarah, tell us about that.
Sure. So a few years ago, Marymount University received a grant from the Administration on Community Living. It's a federal grant, and they received it to implement evidence-based falls prevention programs in the community. So the Alliance is really the community coalition side of that project. We bring together professionals and people who are interested in working with older adults, just sharing information, trying to increase awareness. We share data, we share programs. We're really just trying to make sure that people are aware of this issue and what they can do to help prevent their falls.
And you use that term evidence-based programs.
Right.
What does that mean? Explain that to all of us here,
Sure.
and how does it apply to falls?
Sure.
How does that
So an
work?
evidence-based program really means that the program has been researched and proven to be effective. So when we say an evidence-based falls prevention program, that's a program that has been researched, it's gone through clinical trials, and if that program is implemented the way it was designed, it will help prevent falls. So we can say without question, we think this will help, well, let's try this. These are programs that have been proven to be effective, and those are the types of programs that we're working on disseminating throughout the community.
And are there, I just wanted to clarify, in terms of this alliance, are there quite a few organizations and groups?
Yeah, we have over 60 organizations
What
and
are some of them?
individuals, hospitals, some
Oh, okay.
physician offices, assisted living facilities, home care agencies, senior centers, area agencies on aging. It's really a robust group of folks from multiple sectors. We come together and we talk about how we can keep this issue in the forefront.
And I guess also in terms of the research, I just wanted to find out, has the research changed a lot in terms of falls? I'm just sort of curious as to what people are thinking. Have they changed a lot? Or
I
what
don't
do
think
you
it's changed a lot over the years. We certainly have more research today than we did years ago.
Okay.
And we know, that balance and physical fitness are really,
All the things we
really
talked about.
important. Really
Yeah.
important for keeping someone safe from a fall.
I think what was really happening is that we're paying attention to it more as the population is getting older, and
Right.
we're concerned about that. So,
Right.
well, then I guess my final question would be, how can viewers learn about the Alliance and all kinds of programs that are offered so that they can tie into it or learn more about it?
So we have a website, and our website is novafallsprevention.com. On that website, people can find out about these programs. They can read about the different programs that we're offering and see which one might be a good fit for them. We also have lots of resources. There's that checklist we talked about earlier that people
That's on
can
your
find. It's
website?
on our website. People
Okay,
can find that, and
cool.
a lot of other resources. We have resources for older adults. We have resources for healthcare providers, caregivers, family members. Lots of great information on helping to keep older Americans safe.
Okay, and the website address again is?
novafallsprevention.com. NOVA fallsprevention.com.
All right. Well, I want to thank Sara Pappa and Julie Ries with Marymount University for joining me today. And this program is broadcast Sundays at 5:30 p.m. and Wednesdays at 6 p.m. on Comcast Channel 69 or Verizon Channel 38 in Arlington, Virginia, or it's also streaming live at those times on arlingtonmedia.org. Aging Matters is also on the radio, and the program is broadcast every Tuesday at 2 p.m. on WERA-LP Arlington 96.7 FM. And you can listen to all Aging Matters radio programs by visiting mixcloud.com/Aging Matters. And finally, both radio and the television Aging Matters programs are posted on the Facebook page, which is facebook.com/Aging Matters WERA. Thank you so much for watching Aging Matters today, and please join me again on the next Aging Matters program. And until that time, just remember, age is just a number, not a label.